I think maybe we should go ahead and get started. So just first of all, thank you all for joining us this evening here in Central European time. And what we want to do is we're going to be sort of going over some of the basics of the research that we've been doing, and then kind of go into a specific case example of what I think, and we both think, is a very inspiring case of what's possible for healthcare in the future of healthcare.
Great.
So anything you'd want to add, Manuela, before we get started?
Just that I am from Italy. I studied with Robert NLP in Santa Cruz. I am a trainer. And we started this project 3 years ago, just for our common passion,
Yes.
in order to give some contributions to the healthcare field. So now we are going to tell you something more.
Well, interestingly, we started it before the pandemic, but became very much of a clearly an important project during the pandemic to really understand what effective healthcare is and how we can improve it. So we're going to start with, we're going to go to a few slides here. And we have this idea of the whole notion here is the success factor modeling for the healthcare ecosystem. And I think this first slide is showing this idea of an ecosystem that's like a constellation of stars. And NLP has done a lot already in the area specifically of health, but usually it's in the form of one-on-one health coaching. But we really wanted to look at, well, in this larger ecosystem, when healthcare is really working, what is going right? What's happening? And so our focus this evening is going to be on a particular case, which is the CEMAD Digestive Disease Center in Rome, which is ranked by Newsweek as as the third best hospital for digestive disease in the world. Anything you'd want to add to that, Manuela?
Yes, for these results, we had an interview to Professor Gasbarini that created this center, and he has been my doctor because almost 20 years ago, I had a liver transplant in emergency for a severe hepatitis caused by a medication. And then a few years ago, he have created this Digestive Disease Center with a new concept, with a new philosophy, and by bringing his vision in order to take care of patients.
And so what we're going to do is we're going to go over some of the results of that interview. To begin with, though, just to give a little background, I'm sure that some of you already are familiar with this notion of success factor modeling. It's based upon NLP, although NLP tends to focus more on individuals and modeling individual excellence or modeling individual performance. Success factor modeling is looking more at collective performance, teams and organizations. There have been 3 books so far on the application of success factor modeling for what we call next generation entrepreneurs, for generative collaboration, which is about collective intelligence, and for conscious leadership and resilience. And actually, Emanuela translated the first volume into Italian, and which was part of where this project got started, because her question was, well, what if we took this into the area of healthcare? And the the basic components of success factor modeling are I think this is probably the really differentiating factor, is that we're always looking at the foundation in the area of mindset, meaning, how people are thinking about something, and not only just cognitively or mentally, but the whole notion, as we see, of mindset is going to determine much more about the person. So we say that mindset determines how we act. It's like the software of our biocomputer, and then those actions are what create the outcomes. So in success factor modeling, we're always looking at the interaction between these three things. As you'll see when we go over the case example, we're going to be looking at what kind of outcomes was Professor Gasparini trying to achieve as he was building this hospital, what kind of actions were taken, and most importantly, what was the driving mindset behind it. Now, as Emanuela was saying, this was a project that we started some time ago, and maybe I pass that to you, Emanuela, to say a little bit about how we
started with asking and with reaching all kind of roles within the healthcare ecosystem, and our purpose was to adapt and apply the success factor modeling methodology in the healthcare field for identifying the key factors related to success performance in the different healthcare ecosystem areas, and to create a model with those factors and provide new tools in order to let organization and people apply those factors. So by supporting individuals, groups, and organizations. This. How we did? We started with a survey, an online survey, in order to identify the key criteria for success from the different perspective, from the different roles in the healthcare field. And a second step by another online survey to explore the different level of success related to some specific success case examples. But it has been a quantitative survey. And the third step for an in-depth qualitative analysis of specific case of success by asking questions on all the levels of success factors.
And in fact, that's what we're going to be looking at here. This was one of the qualitative interviews that Manuela was doing. So we had hundreds of people involved in the first survey. And then most of those people also did the second online survey. And then we asked people if they were willing to do a follow-up qualitative interview, and a number of them did. And we were very fortunate to get a number of really important opinion leaders like Professor Gasparini and the CEMAD hospital. So we're going to be looking at that qualitative interview here. Now, as Emanuela was saying, one of the first things we were doing, though, was really looking at not just individuals, but the whole ecosystem. And I think it's actually, this is a rather, I think, unique study in that I don't know of many other studies that are actually looking at modeling the whole ecosystem. Usually you're looking at some part of that, or even just some individual in one part of that. But we really wanted to look at all of the different stakeholders that were involved in producing healthcare, because the performance even of one individual is necessarily going to be supported by the rest of that ecosystem. So it's really, our idea was to create a systemic approach here. And as Emanuela was saying, we were looking at these different levels of success factors I think some of you might already be familiar with this pyramid of the different levels, where we were saying that the outcomes tend to be what is produced in the environment, but that's happening through the actions on a behavior level. And these sort of top areas of this pyramid are what define the area of what we're calling mindset. Particularly one that unites them is what we would call passion. So we were really looking at, you'll see that we were looking at all of these different dimensions of, well, what is it that creates effective healthcare? Because if you focus just on any one of these levels or any one of these aspects, you're kind of fragmenting the whole potential. So we really wanted to see what is it that creates the full result. And there's a lot. We have a whole report where you can find out more even on the website, which will give you the URL. There's an article that we wrote going into more depth of all these different areas. But Emanuele, maybe you can summarize. We did this, started in Italy. It expanded to France and Greece. We also had an international study. And there was kind of some of the main factors that showed up were, some of the common factors were these that we want to share here for just briefly.
Yes, and the first thing that countries had in common has been about the success definition and about clear and effective doctor-patient communication, strongly related to communication skills, and we are going to see this in the model. And the level of the environment, the answers in common among the first results among those countries have been tools or technologies and environment that supports interrelations. And on the level of behavior of the key actions, the common result has been involvement and collaboration. And on the level of capabilities of skills, the common answers have been emotional intelligence and communication skills. And about values and beliefs, we are responsible for our success, where one of the beliefs that people had from their point of view in the success cases that they had in mind, and patients come first. And on the identity level, the identity most common were co-creators identity mindset and connectors. And the last but not least, and on the level of vision and purpose, the results in common among these countries was enhancing patients' ability to face their illness with courage and hope. And about this, we'd like to quote Professor Fabrizio Benedetti, that is one of the most expert of placebo effect, and he teach at university neuroscience, and he also did several studies, and he wrote also a book where he talked about hope, like medication, something like medication, so on the same level.
Yeah. So we gathered all this information, and that was just some of the headlines, the most common factors. But what we actually were doing was looking at typically the 5 top common factors from everywhere in the ecosystem and from these different parts of the world. And we were saying, okay, what seems to characterize the key aspects of effective healthcare? And so this is, we're going to just summarize the model, and then we'll go into the case example with Professor Gasparini and CEMAD. But, so we started with the outcomes, and there were 5 top outcomes that we represented as a star, as you see here. And those were empowerment, effectiveness, efficiency, engagement, and expertise. Now, we didn't necessarily name them this way. This was how we categorized the results. And again, we have another for another context, you can go into much more depth in the details of this. And as I said, we have articles and things about this. But these were the 5 things that seemed to be the most important outcomes in producing effective healthcare. And to support those, there were 5 actions. And you can see that we kind of put the actions inside of the different point of the star, because particular actions also help to support those outcomes. So for empowerment, communication seemed to be the most important. For effectiveness, the action of caring, not just the idea of caring, but the action of care was key. For efficiency, co-creation, people co-creating together in some kind of generative collaboration was important, but also for engagement, just basic collaboration. People needed to collaborate. And for expertise, there needed to be clarity and clarification. Now, once again, we see that all of we've kind of made, at least in English, all of the outcomes are E words, all of the actions are C words. But that was just how we categorize them. And we have a lot of data, though, that supports those. And then from the idea of mindset, here we have mindsets that are most associated with the actions and the outcomes. So the connector mindset, which was a lot about communication skills, supports both clarity and communication, whereas enabler and the compassionate mindset that is driven by emotional intelligence is supporting empowerment, effectiveness, communication, and care. Whereas the co-creator mindset, which is focused on contribution and interpersonal skills, tends to support caring, co-creating, and the effectiveness and efficiency. Whereas we see that the catalyzer mindset, which is a lot about problem solving, supports the actions of collaboration and co-creation, and those outcomes of engagement and efficiency. Whereas builder mindset, which is about competence and self-awareness, supports expertise, engagement, collaboration, and clarification. So this was something very interesting that we found, that we could really show how these things went together in a very powerful way. Anything you would want to add to this, Emmanuel?
Just to underline that we, as Robert has said, we have chosen the top 5 answers, the top 5 results, and we categorize them in this model with the same, by dividing among environment for the outcomes, and then the key actions, and then the four levels of the mindset. So capabilities, and then beliefs and values, and then identity, and then purpose and vision, that are all in the yellow part of the mindset.
And you can kind of see that the low one, the skills level ones, are the capabilities. Then the next one is values. So you have communication skills with the value of connection, and then the identity of connector. Whereas, you have emotional intelligence as a capability, compassion as the value, enabler is the identity. So, and we'll explain a little bit more then about how we put this model into action. but the surveys were only one part of what we were using to build the model. And so in fact, again, this is just another sort of basic summary of that with the kind of the fundamental aspects. And what we want to do, though, is to go in and show, well, we derive this also from these very in-depth in-person interviews, qualitative interviews. And that's why we wanted to do this first webinar is around the case example of the CEMAD, where there were two people, and Emanuela was the one who did the interviews with two people in addition. So in addition to Dr. Gasparini, Professor Gasparini, there was a nurse, Daniela Napolitano, who was also part of the qualitative interview. It was very interesting to get both of their perspectives on this that we integrate in the case example.
And as you can see, just also from these photos, from these images, you can feel that it has to do with a new kind of concept, a new kind of hospital. In the first picture, you can see the waiting room, and it seems a 4-star hotel in an ordinary hospital. So you, if you would go there to see this, you will see an hospital, a public hospital, and this that is in any case with a public health service, but in this way. So the patient could live his experience in a very different way.
You also see in the second pictures very high technology, and I think these two pictures are kind of juxtaposing two of the really interesting aspects of this case, because on the one hand you have this high attention to the comfort and the experience of the patient. On the other hand, you have also a very big focus on technology and some of the latest treatment possibilities. So you have both a relational aspect and the task aspect. And as we go into the case, I think you'll see how these images represent a lot of the very interesting aspects of this. So we're going to start with the outcomes. So here you see a little bit more detail on some of the key statements that were related to these categories. So efficiency was about very efficient and effective health provider organization, whereas engagement is about all of the actors being involved. And in fact, if we look at the qualitative information, probably one of the most important things, I think, that was very central to the mindset that we found, by the way, to be not just in this case, but in many of the success cases, is this idea of putting the patient at the center. Anything you would want to add to that?
Yes, and putting really in the center, not just with words, starting from how they designed the architecture, the structure of this center, and how the physicians' work and other health professionals' work is organized, because the patient is really at the center, and also the doctors, the physicians, and the health professionals move to go to him and not the contrary.
So yeah, again, as Emanuela is saying, I think one of the really unique aspects of this hospital is instead of the patient having to go to where the doctors are, all the doctors come to where the patient is, and we'll see how that shows up in just a little bit. So one of their intentional things as creating this hospital was putting the patient at the center. And they really had this intention to make another healthcare philosophy and concept a reality. They said, we actually are doing this to show that it is possible to have a different approach to healthcare that is just as good. So it's not just idealized. The fact that they are ranked third in the whole world, in the entire world, is, I think, significant. And as a hospital in general, that's for digestive disease. As a hospital in general, they are in the top 50 of all hospitals in the world. So I think this is another very important aspect of this case. So if we look at some of these things between efficiency and engagement, one of the other things that they really set out to do was to create, not just to make another philosophy, but to create a model to be emulated. They wanted to show a way.
And then they wanted to provide personalized and precision approach for each pathology by demonstrating their expertise and by involving and engaging all the actors.
So this is one part of this new model, is to provide a personalized and precision approach for each patient. And then, as we said, this idea of they wanting to bring together scientific research with patient care. So this was part of their objectives from the very beginning, to integrate these things.
And then create a bridge between patients and doctors by a different approach, by communicating, by creating a different relationship.
And so these were the outcomes. So then the question is, so how did they do this? What were some of the actions? And here we see that we have these different aspects that we were showing: communicate, care, co-create, collaborate, clarify. And there's a little bit more detail here about, that communication is a lot about protocols for communication and addressing key issues. And care also had to do with strong interrelations between the professionals. Co-creation has to do with prescriptions for responding to particular situations. Collaborating was an involvement in collaboration. And then clarifying had to do with a lot of things about work routines and procedures. So if we see, well, what did CEMAD do here? Kind of start with, as Emanuela was saying, they literally organize the spaces and work around the patient. So the patient, first of all, we were showing that waiting room, which does not look like a waiting room. And as we'll see, part of what they believed was that the patient should never just be waiting, that the patient needs to be engaged in something that is promoting their health all of the time. So they shouldn't just be sitting in a room waiting. And anyway, so this was one of the key things that the actions was to organize the space around the patient.
And co-create, the actions about co-create was around personalized treatment and approach for each patient. So there are processes, there are prescriptions, and there is a personalized approach for each patient.
And that approach was a multidisciplinary approach. That's where part of the collaboration came in. One of the things that Dr. Gasparini said that I think was just so inspirational, I mean, it really struck me, because he said every patient should have at least 3 types of support. Technical support, or the traditional medical support, but then also psychological support. So you have not only a technical person, but you have a coach. And then also nutritional support, especially for digestive disease. That's so important, so that you're getting these 3. These are all part of what the personalized treatment is about, which is really, again, it makes so much sense, and yet it is very different from what is usually done.
and then raise funds. That was basic. And by creating partnership and by creating alliances for raising funds and acknowledge donors publicly.
And that one of the other things, and this relates to this idea of the expertise, was they created what they call a hybrid room, which is ranked again #1 in Europe and #2 in the world, is this room where the patients come and then they do what's needed to be done in the same room. So instead of a patient going around to different experts who don't know anything about what each other is saying, they just go here and they get one piece of information. They go there and there's another thing. Actually, all of the key actors come to them and they have to communicate as well. So they have to know, they have to actually discuss what they're doing. So this is one of the really big things. So there's a collective intelligence that starts to happen here in this hybrid room, where the different things are coming to the patient in order to create this multidisciplinary personalized treatment approach for each patient.
And then the essential role of the team and the team leader. So they had weekly staff meetings with feedback session and turn the message step by step, and control the activities of each clinic and make reports in order to underline what worked well and what had to be changed.
And one of their other actions was to transform waiting time into training moments for patients, as we said. In other words, they said that the patient should never just be waiting. They should be learning. And we'll see about that in just a little bit, how that worked. But they also, one of the actions was to create a nutrition hall where there were videos on big walls about nutrition, so that, again, instead of just sitting there like we've all done, I've spent many hours in waiting rooms waiting, kind of bored or not sure what to do. Whereas here, you're being completely engaged the whole time. So we think that this was some really key things that just shows these are an expression of what we mean by these categories, that these categories are not just kind of abstract, that they show up in these very specific actions, as we see in this particular case. So now we want to go to, and this idea of designing a pleasant and adequate environment, as we saw in those the photos leading into the case example. So these were all the actions that were supporting those outcomes. Now, again, key here is, what is the mindset that allows that to happen? And this is where these ideas of, the connector, enabler, co-creator, catalyzer, and builder come in. And as we kind of start with this idea of the builder, where what they really wanted to do, their whole approach, their idea was, we want to provide the best healthcare in the world. And for us, that's important. If you don't want to do that, you can do a lot of other things. But if that's your mission, if that's your vision, your purpose, a lot of other things are going to have to fall into place. And then going along with that is this belief that excellence calls for excellence, and that each physician also needs to feel themselves to be a leader. Now, imagine if you're building a healthcare system around these things that everybody shares, it's going to be a really different kind of an endeavor.
And this is strongly related to enthusiasm, because Professor Gasparini said that he wanted only people that could have enthusiasm, because he needs that patient feel this from their physicians, from their health professionals. And then also spaces belong to those who use them. If you go there, you can see that there aren't out of the door the name of doctors, but just the name of the room and the use of that room, because that room could be used from all the physicians, all the professionals that need it.
I think one of their other key mindsets was that everybody, but especially the patient, but also everybody should enjoy and be learning something. And that's part of their co-creator mentality, and that part of this idea of enhancing the patient's ability to face illness with courage and hope. And some of their other values there were empathy and relationship. So here you see we're providing the best healthcare, but empathy and relationship have to be a key part of that. And then respecting the person and his or her time. That's part of where the enabler comes in: compassion, emotional intelligence. And then finally,
the hospitality. And there are specific people, specific women and men that can welcome patients and their caregivers, and in with kindness. They had specific training for this kind of capabilities and attitude. And the appreciation for people who did something good. This is about giving them feedback, a constructive feedback, and in order to acknowledge what worked well and their effective attitude.
And also what we call feed forward. Now I'm sure there's a lot of interesting questions about this, and that's what we want to spend some of the rest of our time doing. But just briefly, so this is an example. You can see this is a concrete example. This exists. It's profitable. It is ranked highly in Europe and in the world. So this is an expression of what we are getting at with this healthcare model. Now, one of the things that we've done is based upon the overall research, but also particular examples like this. We've created an online healthcare scorecard. And you see here, we're not going to go over the whole thing, but people go and they rate the present state of these actions. You know, what is the level of engagement right now, of empowerment, wherever they are in that ecosystem. You know, from wherever your role is. You could be a researcher, you could be at the administrator, you could be a receptionist, you could be a nurse, a doctor, or you could be an insurance provider or a pharmaceutical person. But as you look at your ecosystem, you're part of that ecosystem. What's the current state of engagement, empowerment, effectiveness, expertise, efficiency? And then looking at a particular time frame, because obviously you would want everything to ultimately be fives, but if you're looking at something like the next 5 months or 6 months, and this is one of the things that became particularly significant during the pandemic, is that these things get all jumbled up because of disruptions. So what are you going to be focusing on? And that's what the green represents, the desired state. And what the assessment can do is then show you, well, where do you need to focus? First in the area of mindset, then actions, in order to be able to produce those outcomes. And key to that then is that we developed what we call a effective healthcare mindset skills training. So it's about, well, given wherever you are in the ecosystem, if you need to improve something like empowerment, there's going to be certain kinds of skills at a number of these different levels. So there's going to be skills, there's going to be certain kinds of priorities, there's going to be a certain kind of identity and a certain type of purpose that you're going to need to take on. And so we have, and in fact, we are going to be starting a general cycle of these skills trainings, these mindset skills trainings. We did a first cycle last year, but we're going to be doing next one this coming year. And it's for people, and our last one was very interesting because we had people in that program who were doctors, we had nurses, we had coaches, we had, what other roles did we have? Yvonne
trainers,
is,
consultants,
yeah.
and also a provider
Healthcare
agency
provider.
for education for doctors in medicine.
Yeah. So our first one is around this idea of the connector mindset, and it focuses on communication skills for expertise and empowerment. In February, we have the one on the enabler or compassionate, which is about more emotional intelligence. Then we have the catalyzer in April, which is about problem solving, co-creation. Our builder mindset in May, which is about self-awareness. And then the co-creator and contribution in June, which is about interpersonal skills. And each of these modules is 2 half days online, 5 to 9 p.m. Central European time. And also in June, we're going to have a trainer's training for people that want to not only learn those skills, but maybe bring them into their own part of the ecosystem. And we have several people from our first cycle that are interested in doing that. We have a doctor who's bringing this to physicians in Belgium, a woman who's a nurse that's bringing this into the Netherlands, and of course, others that are bringing to Italy. So this is something you may want to consider if you find this to be something that is connected with your mission. Anything else to add about that, Emanuela?
No, just that our purpose is to spread this model and these tools, these skills in the healthcare field, and so this is the reason why we started and we are going on with this.
So if you're interested in that, you can register. That you can also find that information on the Tilt Strategy Group website or the SFM for Healthcare website. And we just like to end the presentation part because we want to have some time for questions here. But one of our sort of metaphors for what this whole research and the training project is about is related to this notion of candles, and I will pass that back to you for that, Emanuela.
Yes, this is what I was saying, because we started with this metaphor by Buddha, like candles. So we started, Robert and I, and that's it. And with this metaphor that thousands of candles can be lighted from a single candle, and the life of the candle will not be shortened. Happiness never decreases by being shared. And it's not only this, because when you light another candle with a candle, in that moment, it's bigger, the fire, because it's each other, a nutrition, each other, and something that we can give and bring from people by learning something new. So this is the way we are thinking about spreading these values. So
thank you for that, and we don't want to, we're not going to end here. That's sort of our presentation, but we're interested now in finding out what kind of curiosities, questions you have, either about the study, about the particular case of Dr. Gasparini, or about the training, or anything about this presentation. Because I think this again is something that we've been really, as you can see, putting a lot of effort and interest into the last 3 years. We are currently still, for example, this next month we'll be doing some interviews relating to institutions here in France that will be doing some of our qualitative studies here in France. Toril, yes.
Yeah, thank you very much. I'm excited about this. The thing is, I don't work inside the healthcare system, you know that. But tomorrow at 10 o'clock, I am going to a meeting between healthcare scientists at the universities in Norway and businesses working with, with the healthcare system.
Yes.
So my first question is, would it be possible to have like a link to this 1 hour so I can give them the link and they can have a look at it themselves?
Sure. Yes.
Yeah.
We're recording this, so
Yes.
we will have this, and there's a lot of, these days, a lot of people register for these things and are not able to come. So we definitely, we're going to be posting that.
Great.
And we should be able to have that up by tomorrow.
Yeah,
And
this starts at 10 o'clock tomorrow morning.
I think we can manage it for you.
Yeah, that would be great because, this is very close to my heart. I was disabled for 22 years.
I know.
Long time. And everything that you're talking about is the things that I were missing, during that. And I actually had to travel abroad to heal myself and study to learn and stuff like that. But I am also business-wise now probably saying yes to a position where I will have the power together with politicians to change the life of about 1.6 million people. I haven't said yes yet, but I think probably I will.
That's fantastic. And you know what, Toril, actually, one of the things we're going to be doing on our next one is we're going to be doing a case example of a patients association who so it's people who are patients. Start off with the person who was a patient, then gets together people who are either patients or others who directly were involved. And this person involved politicians, doctors, and Manuela can say more about this, but he's literally, in the space of probably 3 years, saved the lives of at least 250,000 people.
So at the right time, Robert, I will bring this to the Minister of Health.
Yes.
At the right time.
Yes. So and also, Toril, that this is what we mean by the ecosystem, is that it's not just doctors or nurses or even specific healthcare providers. You need all of this support and the minds. It starts with the mindset. And that's part of what this idea of the candle. You're going to take your candle and start lighting these other candles. And the great thing is,
I'm taking your candle. Lighting. Because the biggest problem that I had was that in Norway we have an official healthcare system, so we don't pay for going to doctor or anything like that. But since people are getting happier and happier, earning more and more money, the government does that too. So the system we have is like from the Second World War, it hasn't really changed. It's the same idea, the same beliefs, all that. So the worst thing for me was I wasn't heard. When I came up with methods like breathing methods that really helped me, no one could do anything about it because the system was so that's why tomorrow morning at 10 o'clock, it's very important that these business and healthcare is meeting.
Great.
Toril, could you put your email in the chat, because I try to send you during the night with different time, probably my.
But I have that. I have downloaded. I have that. I have signed up for everything.
Okay. Yeah.
But if you put your email in the chat, she'll be able to get that to you for sure.
Yeah, you have it.
By the way, Toril, one of the most really interesting things that this Professor Gasparini said, that he says, if you are a physician and you do not know about the first 6 years of your patient's life, you are not doing your job. You, to actually treat the patient, you need to know, especially about these very formative years. And and that's just, I've never heard physicians say anything like that.
I have something to say about that, Robert, because this was a head injury I got in that car accident.
Yes.
I have been through lots of psychological tests, but they all start with your childhood. But my childhood was full of violence and stuff like that. But when I started with neuro-linguistic programming, I cleared my childhood. Yes. So it's not there. But when they asked, I said, yes, this was happened, but it's not a part of my neurology anymore. So they came up with the wrong, they became confused. So I do not really agree with that. If you have done your NLP training, then you probably.
But you have to know. You have to know if it's been cleared or not. I think that's the point.
But then they also have to know what happened when you was like 20 and 30.
Yes, it's not only. It's not only.
Sorry about that.
No, that's okay. But I just think that is also an interesting aspect of part of this idea of a personalized, personalized treatment. And you're right. It's not just the first 6 years, but I think that's part of that.
Communication go both ways.
Exactly. We only have a couple more minutes. Anybody else have any comments, questions, clarifications?
In the meantime, I have put the link for the training in the chat for the enrollment.
In that.
Yeah.
Yes, go ahead, Walter.
Yeah, I can only say what Toril said before. It just comes at the right time.
Yeah,
I signed up for this event today, last minute, last night.
Yeah, wow.
When I came across it, and the reason is I'm preparing for a coaching mentoring program with people in it's called an innovation challenge.
Wow.
In healthcare. It's organized by the Diabetes Center in Bern in Switzerland. And so I was paired up, I was chosen by a couple who started a company in 2019. And they're devoted to something they call digital diabetes.
Wow.
So they developed something, I would call it a virtual clinic, which is patient-driven and patient-centered. The starting point is, at the moment, because that's what they have ready, to help people with diabetes type 2 to organize their lives, to be in constant contact with the nurses, with the doctors, to have their nutrition advice, to have a lot of things that they need, the full package. And in the first session, I asked them, so, and what is your vision?
Yes.
And what do you think where you will be in the end? And then I saw this this slide saying, the most important thing is that the patient has hope.
Yeah.
And the patient is empowered.
Yes.
So there's a logical thing that starts with type 2, and we know that type 2 diabetes type 2 is often triggered by adipositas.
Yes.
By being overweight. It's not the only factor, but so identifying risk factors, and the next level is working with risk patients.
Yes.
So etc. So I got a lot of fantastic impression from this evening here. Thank you so very much.
Fantastic.
Thank you.
By the way, just so you all know, the way that we do the training is you bring a project, and we also show in our training, we use videos and things to show how these kinds of skills look specifically in healthcare area. So I think that's another important innovation that we've done in the way we do the training, is we're tailoring it. It's not just any type, it's not just communication. Of course, communication has a lot of common factors no matter where you are, but we're really showing what's the implication of this and what does that mean specifically in healthcare environment. Yes, Jan.
Yeah, I'll try to be very short. Thank you very much. First of all, congratulations on what you're doing. I'm very, very passionate about NLP interventions in health.
Yes.
By the way, Robert, I'm also a trainer and the coach, and the neurological levels don't miss one of my course.
Great.
I'm a huge fan of this model, and I think it's very useful. My personal interest, I was very curious to understand what are you doing. First of all, it's a very nice system modeling. I'm not very fond of systems, by the way, but I am very interested in finding out how to apply NLP in order to improve health. I also read about your mother, the stories, and I was very impressed. And I don't know how maybe I can write you some emails, or I don't know how to. I'm very interested in finding out case studies about NLP interventions on health.
Sure.
Diseases, allergies, and
yes.
It's I didn't find the materials on this, and I'm also interested in NLP approach to organizations, systems.
Yes.
You are now higher on the system level.
Yeah. I mean, I think it's interesting because part of what we're doing is we're saying those two things go together and they support each other.
Yes.
The individual can't really do what they need to do if the system isn't supporting them. And especially if you're trying to do, as Toro was saying, is you're trying to do something different or something new. If the support there isn't in that system, you're fighting, whatever metaphor you want to use, you're an uphill battle, or you're swimming against the current. So that's a big part of why we're saying the system and the individual is really key here. And it's not one or the other, it's how we integrate them into.
I can understand this very well, but believe me, I'm now doing a one-to-one fight.
Yeah.
It's from my position, fighting with the system is very difficult. I prefer to help people one by one. You will do the hard work, and we will come after as soldiers and try to integrate things.
Well, think of it this way, though, Jan, that you're taking your candle, any other candle you light, and then that candle lights another candle, and that's our metaphor. I don't necessarily have to do it all at once, but even lighting one candle or another. So I think you're on the right track.
I hope so. It's from my heart, and congratulations for everything you've done and you will be doing for sure. So I try to keep close, and
great.
Thanks a lot for this.
Thank you. And thank you everybody for joining us this evening, for taking your time. It's really great to see you all. And I look forward, maybe we'll see you more in the program or in the coming webinars. We still got a couple more that are really interesting. They're kind of completely different parts of the ecosystem. Our next one is about the patient association, and then about the National Transplant Network of Italy, which was very interesting because doing transplants during the pandemic was a real big challenge. So adjusting and adapting was really interesting, and it really shows you where and why some of those success factors are so important, why some of those skills and some of those outcomes are so significant. So until then, I see that Christian, you have your hand up. Yes. Good.
Yeah, maybe I can say one thing. Because I'm 31 now, and I never really cared about health and something like that. And my wife is learning about health and food, and I think I never cared really because there was not a vision like that. Now I saw what you developed, and I'm amazed of the potential it has on as impact on the world. And I think so. I was going to the IT to work, but with this vision, I could myself imagine to be in the healthcare system, because you created a so genius vision. So thank you for your work.
Well, thank you. And Chris, that's the whole idea of lighting the candles, and it starts with passion. We like to say that passion is like the flame of the candle. It's where the heat comes from, and it casts the light and the light is what creates the vision. So when you light that passion, then you start to see these possibilities. So may that that passion carry you.
Yeah, thank you for that.
Thank you.
Thank you.
Well, just one last thing.
Yes.
You are doing this kind of, I see it as a sort of a fight. So you are doing the fight of the upper level.
Yes.
And we are trying to do the fight on the individual level, just to help people change.
Yeah. Well, we're doing it on both. We're doing it on both levels. Actually,
very important.
I start this next year also here in France. We're doing a health coach training specifically for health coaches who do work one-on-one with people. But also,
I will follow you for sure, Robert. Thank you very much.
And what we're doing in this program is also, again, it's stuff that you will do. It's not only one-to-many, it's often one-to-one. And I think we change the world, you know, one candle at a time. But as Emanuela says, that it continues to, you bring more light into the world without losing any of your own light. And that's what's beautiful about it. So thank you. I just feel the sense of passion, and I'm really leaving this with a very, a lot of energy. So thank you so much.
Thank you, and see you during next webinars. You will be welcome to join us.
And we'll have this, the video for this, we'll get it to you as soon as possible, Toro, and we'll be having it up so that, you know, if you want to pass it on to other people as well. Okay, thank you all. Have a good rest of your evening.
Bye-bye.
Bye-bye. Bye.